May is Mental Health Awareness Month. According to the National Institute of Mental Health, in 2019, nearly 1 in 5 U.S. adults live with a mental illness, accounting for 51.5 million Americans. Social distancing and isolation during COVID-19 pandemic has only made things worse for some people living with mental illnesses. The impact of the mental health crisis on children is equally profound, with a May 2020 Gallup poll, which reported 29% of parents with school-aged children indicated that their child was experiencing harm to their emotional and mental health because of social distancing and closures. Another 14% said their children were approaching their limits, saying they could continue social distancing a few more weeks until their mental health suffers. That was last May. Our public schools already do a lot to support students living with mental health issues. Many districts offer trauma-informed care to help students cope with their mental illnesses. Before the pandemic, American School Board Journal, NSBA's flagship magazine, traveled to Kansas and spoke with Topeka Public Schools USD 501 Superintendent Tiffany Anderson about the district's trauma-informed care programs.
Trauma-informed care really supports all students. Now, I will tell you in Topeka, in addition to being 77% free lunch, we have 600 homeless students. And so when you think about 14,000 students, 600 of which classify as homeless students, you really are talking about students who have a variety of adverse experiences that they come into school with. Those experiences can be everything from going without food or clothes, living in a car, the other kinds of things that high poverty families might experience, which could be a parent working 3 jobs, therefore children raising children. And so just a variety of issues can face young people. Now, when students come into classrooms, really, whether it's disengagement, volatile behavior, lack of interest in school, those are things that you might see. But you also might see behaviors that are indicative of secondary trauma. So students who have not come in with adverse experiences or who are not high poverty may very well have traumatic kinds of situations that occur, ongoing or situational. So really, trauma can affect anyone, any age, anywhere, which is why it's important to really understand mental health and make sure that mental health is incorporated in classrooms and in schools from preschool all the way through 12th grade for both students and adults.
We must normalize the conversation about mental health to lift the stigma. As Superintendent Anderson says, trauma can affect anyone, any age, anywhere, which is why it's so important to really understand mental health. Please visit the link below for strategies to consider when supporting our students and staff with mental health illness. Thank you.